buttock muscles can be bigger, then the force will act in the opposite direction. Those who have had a straight back body shape until the last time, you were concentrating on the spinal movement. What should you do with your spinal exercise? You need to position your pelvis. It can be a little difficult to express the position of the pelvis, but if you have a straight back posture, your pelvis lies back. In biomechanics terms, it is expressed as posterior tilt. I express it like this. What happens is that the mass of the buttock muscles does not increase. A lot of people are trying to make apple hips. Many people are trying to make their butt muscles bigger. When I look at people who are standing or walking on the street, there are people who don't have too much hip muscles. People don't like it aesthetically either. Physical problems can also occur. The buttock muscles are the middle part that protects the lower back and legs, acts as a bridge. They have to have hip muscles to protect your back. They can protect your leg muscles. If they don't play the role of this middle bridge, your back will get tired easily. It may be hurt, leg pain and muscle stiffness. These things can happen. Butt muscles are so important. You can do an exercise for the gluteus maximus muscle. However, no matter how much the gluteus maximus, a person with a straight back posture, even if your exercise don't have bigger muscle of the gluteus maximus. For example, doing squats, deadlift, and so on. No matter how good the exercise is, the buttock muscles will not grow. This is because the pelvic bones are not in correct position. The first thing to do is exercise for the spine, and you have to exercise to position your pelvis. This means that you can come up with exercises that can increase the mass of your buttock muscles. First of all, you need to know the exact position of the pelvic joint. The neutral position of the pelvis is there is a palpable area on the anterior side of the pelvis. There is the most protruding part at the top of the part. It is called ASIS. There is a protruding part, and at the bottom area of the pelvis is the pubic symphysis. There are two pelvis on each other. It is stuck at the bottom. When looking at the pelvis from the side, ASIS pubic symphysis under the pelvis. When the joint is viewed from the side, a vertical shape is a neutral state. Pelvis should be in a neutral state like this. It can increase the size of your buttock muscles. All those with a straight back posture are posteriorly tilted. Your pelvis is lying on your back. The strength of the buttock muscles does not work and the muscles are not formed. So it is very important to recognize the position of your pelvis. Understand the position in neutral. What you can recognize is whether you exercise to keep your health or do you exercise to build muscles in your body. Rehabilitation exercise, you're doing it while failing it. You just grab a barbell and run and walk a lot. That doesn't make our body healthy. Understanding the correct alignment of your body. It is important to exercise in that state. The neutral position of the pelvis is important. The neutral position of the pelvis determines the neutral position of the spine. The pelvis determines the position of the cervical vertebra. So at first, the position of the pelvis should be in a neutral position. The exercise is very important. Let me tell you about exercise, but do not overdo it. Straight back posture is a body type in which the weight of the pelvis is pushed forward. Because your upper body weight is pushed diagonally forward, a condition in which the spaces in the back of the spine canal are greatly narrowed. It could cause stenosis. People with this body type are easily affected. So that if you make too much anterior tilt, because the spine is under a lot of pressure on the back, it can be a nuisance. Never overdo it. It moves in the anterior tilt direction. I'm saying you shouldn't overdo it. Lie down on the mat. Can you feel your lower body touching the floor? In that state, I'm trying to raise the waist space slightly. Put your back on the floor and make room for your back. First, try to create a lot of back space. It must be an anterior tilt. Your back will be completely posteriorly tilted to the floor. It becomes the form that the side is lifted under the pelvis. I said the posterior tilt was the problem. You keep living long as if you're in a state that is too posteriorly tilted. Whenever you are sitting, standing, or walking, you're still walking in a posterior tilt state. So you have to make a slight anterior tilt. If there is too much waist space, it could be hard. Just lift it up slightly to the neutral position. It feels like the belly button is being pulled up and the space between the floor and the waist is slightly raised. You have to understand that feeling. The space between them is about as much as one hand goes in and out. Put your back on the floor again and repeat the movement to create space. After you learn this move, you understand how neutral you are. You're practicing holding in that state. You're practicing neutrality. You have to understand it with your brain. You're just in holding on, thinking that the belly button is pulled up upwards. Give your lower back a feeling of being pressed slightly toward the floor. Then the force will act in the opposite direction. Belly button pulled up. The lower back gives a slight downward force. The space between the floor and the lower back should be separated. It's not about putting your back on the floor. You should be understand as applying a little force while raising the space. This way you can match the length of the erectus lumbar spine. You're working out to match the length of the muscle. You have to practice the pelvic position like this to understand it. You can hardly understand it. Essentially, you should be recognizable. It is important to recognize this first. Do it often and before doing this exercise. Then you have to do gluteus maximus exercises. I said the straight back posture is a structural problem with your spine. While solving the problem, even the problem of the pelvis, we have to solve it together. I'm talking about a physical problem. I'm not talking about medical damage. The pelvis and spine must move together. Spinal and pelvic exercises should be done at the same time. Then do gluteus maximus exercises. This can lead to lower body movement. Continue to practice holding your pelvis in this way.